Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer. The content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode. Welcome, everyone, to the Myohacker podcast. We have an incredible guest today. I have loved using this resource that she created how many years ago?
So I had the idea about 15 years ago, but I actually patented it and started to, use it and sent it around for different clinicians to try out about 7 years ago.
Okay. So thankfully, I guess I've been using for about 5 now. I love what Cheryl has done. So this is Cheryl Pelletier, and she is the creator of the SideBiter, which if you have had children in any kind of feeding therapy with me, you have likely seen this tool. It is an incredible option for, actually, I'm not going to jump into all of that. Let's step back for a second and tell us about yourself, Cheryl.
Okay.
Tell us where the inspiration came from and why you made this tool.
Okay. So I go by Shasha. That comes from a little boy with apraxia who we were tapping out some syllables, and he learned to say mama, and he pointed to me and said Shasha so I go by Shasha. I have been a speech pathologist for 39 years. About 27 years of that, I was doing exclusively oral motor and feeding. Over the last, I would say, 10 to 15 years, there were more and more medically complex patients that would come in an outpatient setting. I was in a Boston hospital satellite for 25 years. And it wasn't just the new eaters or, kids with prematurity. These were kids that had multiple special needs, and they had G-tubes since birth, and now they come in and they're 7. And because feeding therapy became such a big buzzword, the clinicians in Boston and all over the hospitals were like, yeah, I know you've had a G-tube for your whole life, but how about you go to feeding therapy? And really hard to get the maneuvers and the proprioception of using your jaw and your tongue for a chewing motion when there's no food involved.
Yes.
So I was using a lot of the tools that we have, including silicone straws, bending them in half, putting holes in it, because what I wanted to put the food in the areas of the mouth that would cue tongue movement, rotation, lateralization, elevation, any kind of movement that wasn't just related to a liquid.
Yes.
So some of these kiddos were on a liquid diet, thickened liquid, and puree is a liquid. Mm-hmm. And so you do a very different maneuver when you are sucking and swallowing a thick liquid or puree. So, I was using my gloved hand, I was using chewy tubes, I was using everything I could, but it wasn't really translating to home. And I was like, if I only had a tool that was the length of my finger, that could get food in the back, and I could maneuver it as I was getting that tongue used to flavors back there, a little bit at a time. Mm-hmm. And I also, in my setting, worked with a fair amount of developmentally delayed adults. So if you can imagine a 65-year-old with Down syndrome who then had a heart attack and a stroke, and they were great eaters. Now they have a G tube and they cannot understand why they can't eat pizza. And I'm trying to re-educate the mouth and trying to get them to activate a swallow on time without having them have a big piece of pizza. How am I? And even when I was making into strips, it was too much and they were not having the purees. They're like, oh, you're going to puree my pizza, no go. So then they were averse, and then I had to undo that. So I kept drawing this tool. So I always say this tool found me. And I was sort of obsessed with, how could I put something in and make it grippy so that ages 2 to 102, because I thought there's so many things for babies. But I was like, there's a disconnect. So there's a reason why it's the size and shape. It's the reason, like, it stands up on its own so it wouldn't fall down and get contaminated.
So important in the hospital. So important.
People that have motoric problems, I've learned from my PT/OT friends, it's easier for people to do this than to pick it up this way. Who knew? So it's designed to stand up. It's designed so that if somebody had a little hand.
Okay, can I just say, I didn't realize it was designed to stand up. I don't, I mean, I'm usually using it, so it's pretty busy. But
so the reason I have it standing up is in my practice, I usually use 2 or 3 at a time with different flavors inside. So I might have pizza in this one and then cake or a muffin, something sweet, pound cake, something enticing. And so that linguistically my patient can be, because I'll have the actual pizza here talking about it, putting the juice on it and saying, okay, what would your mouth like to experience, or your nose or whatever? Would it be something salty, savory, all the language, like pizza, or something that might be sweet, like frosting or French toast or something like that? And whether they can look at it if I give 2 choices, or they can point or talk to me or help me load it. The point is to not use this very long. This is the mini, which I'll talk about in a second.
Can we just say, that is such a huge point. I feel like I get people that will be like, I don't want this because I don't want to eat that way. I'm like, this isn't a forever tool. It's not.
It's a bridge tool.
Yes.
So I worked with Lori Overland. I don't know if anyone knows her, but she's like a guru.
I think everyone knows her. She's
so
amazing.
When I got the idea, I actually called her from a ski lift and I said, Lori, I have this idea. Tell me now if it's a dumb idea. I won't do it. And she's like, yes, you should do it. So originally I tried to make it thinner. I tried to make it like my pinky. But when I was working with an engineer, both of them, I wanted them thinner, just so you know. But when I was working with the engineer, he said, you want it to be durable enough to last enough time to get the 126 muscles that you're working on to get better, be durable, and also be able to clean it.
Yeah.
So I had a specially designed scrub brush designed to scrub out. And he said, you can't go any thinner because it's going to be super hard to even put food in it. So I said to him, okay, I want a 1/4 inch thick strip because we want to get to this, right?
Yes.
Right. Okay. And
guys, if you're not watching this, if you're just listening to this, I want you to know you can go to the Biohacker podcast on YouTube and see this. This is going to be a very visually rich podcast interview. So I highly encourage you to listen right now as you're driving, as you're walking, whatever it is you're doing. And then later jump back in and watch the videos so you can see Cheryl. She is demonstrating as she's talking, and she just lateralized her tongue beautifully, showing us what that chewing motion, how it can produce that. So I don't want you to miss out. Okay, keep going.
So that was a strip of pizza, but the idea was, and believe me, I chewed on a lot of things and a lot of food because I wanted this. I wanted to get the food in the back, and I started to use with real small kids, I started to do this and just kind of maneuver it. I'm just showing you, the audience, that you can do a lot of different things with it and use your creativity. I also really learned that I could angle the 5-hole one, which is level 2.
Mm-hmm.
I could angle it so that if there was a good chew on it, that the food would extrude either in the cheek, on the base of the molars, or toward the tongue. It also was super helpful to show my clients, I know there's a strip of apple in here and you've been doing this, and I'm going to simulate not chewing, and you didn't break up the apple. You need to really get strong. And because they had no idea that the molars had to come together, or they didn't have the stamina or strength or cognition to do so.
Mm-hmm.
So that's how it started. And then again, I wanted the length of the handle to be so that this is me, on this end, could move it with the person. If they could actually really hold it, that would be great. If not, and I also worked a lot with those easy grips or the easy holds. They're these rubber things that you can put on toys and utensils. And if the person can't close their hand, they still could slide in and hold the device. So fast forward, I had a lot of people saying, have you ever thought of making something smaller? Well, I learned a lot about manufacturing, and I'm not a manufacturer. I'm a speech pathologist. So
Can I just say for a second, I am sure there are SLPs or OTs or moms listening going, I'm not a manufacturist. I can't create this thing.
You can.
And I want everyone to hear Cheryl did.
Yeah.
Okay. So you're going to walk us through that.
Yes,
and
so
just, you don't have to get all the details, but yeah, I mean,
So
I think it's so important to share. We need to be generating new ideas, new innovations, and not stick ourselves in a box of saying, well, I'm not a STEM person. I don't do, this isn't my specialty. Who cares? You didn't care. You cared too much. You cared so much for your patients that you said, I'm going to break these boundaries and overcome these hurdles because I want to change lives.
I tried so hard not to make this, because I'm serious. I was like, nope, not going to do it, because when I was reaching out I'm in the Boston area, and I thought, oh, there's all these schools that have engineering. I need an engineer to draw this thing and to create a computerized rendition of it. So then it goes to a silicone company, which I didn't have yet. And everybody laughed at it. They're like, wait, you want this thing the size of your finger that goes in your mouth and chew on it? And I was like, I do. And I only want, and so some engineers were like, well, you need a handle and then a tip and then you need a lock. And that was 3 parts. And what I learned was, each time you make a part, it means that a mold maker, there's such a thing, a mold maker has to make a mold for you. And each mold is $45,000. So I said, I only want 2 pieces. I want a piece that will hold the food in, and I want it to lock on the bottom, and I want it to be tight enough so that raspberry juice doesn't come out.
Yes.
And I want a drool guard so that people won't get wigged out when they are drooling out the pizza, and their hands won't be wet when they learn about a new food. If they are a selective eater and it's a juicy peach, they won't freak out as much.
Right. There's going to be a bit. It's okay. Right. That's why you have 3 stages of it.
Right. So I have, yeah, exactly. So, oh yes. And I couldn't just invent one. I thought I need a hierarchical way to introduce food, from, if it's a dysphagia case, from NPO to all the way into more of the food entering the mouth that would simulate actual chewing and swallowing, prior to the time that you could introduce ground grated strips of food. So my background is, I worked inpatient for many years in Boston, and the speech pathologist was sent into ICU when people would wake up from a coma and they didn't know where they were, and the doctor would say, do an oral exam and see if they
And
can
they're in
eat.
delirium.
And all we had were toothattes and like lemon swabs. And you could seriously lose a finger, or they have this clonic bite going on. I'm like, I need one of these.
Yeah.
Because just to get them to like kind of maneuver, get their saliva going, whatever, maybe a little taste of apple juice or pumpkin or anything. Anyway, so the concept didn't leave me alone, and I had to do it. So once I found an engineer whose actually grandmother had just had a stroke and was NPO, who got it. I got somebody that got me.
You needed some buy in the game. They needed to have just skin in it, that they were like, I understand that this matters, and it wasn't distant from their lives.
Yep. So he quickly, within like 48 hours, had a computerized little design, which I guess is plugged into a machine once that you get the molds. So I was the one that said, can't I just have one big piece of mouth safe silicone, which is what this is. It's latex free. It's the company that I found in upstate New York is called Extreme Molding, and they make baby bottle nipples all day long and breast shields and little toys. So this is FDA approved mouth safe silicone, and then this is mouth safe too. It's just, and the reason it's green is because nobody that I've ever, very few people that I've ever worked with were willing and able enough to put green vegetables toward their face. So this is the same. This is green bean green. And then so anyway, so they manufactured it for me, and that was exciting. And then I came out last fall with, this is the mini. So
I love the mini.
I called the manufacturer and I said, I don't want to pay for another mold because I don't have any money left. I had 6 credit cards to the hilt. This was not easy. I didn't have the money. I just kept putting it on credit cards. So anyway, so this is yellow because it's a food color. And he said, all we have to do is put a piece into the mold and make it half the size. So I said, I want 3 holes on one side, 3 on the other. And I also wanted to do one with no holes, because if it's a closed system and you're working on facial strength and lip closure and endurance, it's hard to do it with something with holes in it. That's why we need a pacifier to do resistance, and not a bottle. So if you do the mini 0 with 0 holes, this one actually is the one with holes, but see, I can't even get a seal on it. But let me find my mini 0. It comes together as a bundle, or it comes separate. The bundle is the mini with the 6 holes and the mini 0. Now, the mini 0 has been super helpful for just getting like kids that have never eaten before, and you're trying to get them to actually do some propulsion from front to back. This is the mini 0 holes.
So Cheryl has the mini in her mouth and she's sucking on it right now. Are you pulling on it as well?
Mm-hmm.
Okay, so she's giving herself some resistance. Are you pushing down on your tongue or just coming out neutrally?
So I'm trying to simulate cupping, which is what we're trying to get some good suction and in the mouth.
So
and
cupping is when the tongue is going to actually groove up, like the edges of the tongue come up, which helps with the control of whatever we're trying to swallow. Because if it's just kind of flat and we don't have these borders around the tongue, that's where the swallow can get, well, one of the ways that a swallow can get messy and discoordinated. So it's great to be able to work on cupping with this tool.
Right. So you can use level 1 SideBiter, which has no holes, or the 0 for those really, I mean, you can get a good pull tug of war with that. And you can use, what I like about the ones with no holes is you can freeze liquid in it. or a puree, and it doesn't leak into the mouth unless you're ready for it to leak into the mouth. That way you would go to one of the products that has holes in it. Now, people that are NPO, meaning that they're not eating or not cleared for eating and don't really have the skills to maneuver enough to handle food in their mouth, that's when I get worried about using chewy tubes or silicone straws with food inside them, because it ejects into the
Yeah,
mouth.
fast.
And so then if you don't have the tongue humping in posteriorly in the back, you have no way to protect your airway. And we're trying to get these skills going at the same time as we're protecting the airway, so that we can go to strips of food, or before that, grated, ground, fork mashed in a hierarchy that way.
Mm-hmm.
So that's why I like them. And a lot of families are buying or getting the two together because the family members can model putting this type of thing close to the mouth. And I often will use it without the plunger, because I just let kids hang out and do whatever they want. The hole seems to be very enticing. There's a hole at the bottom where
Yes.
so kids are like they're like, look at all the muscles. They have to use all 8 muscles of their tongue to point and get it in that hole. And I'm like, great idea. And then they can do there's
Guys,
so
you
many
have to
things.
watch this. This is so fun.
They
This
can
is
do
so
so
fun.
many things with it without
Yeah.
rushing in
Yeah.
and making it all about food right now.
Right. It's experiential. It's really enriching their oral motor sensory input in a safe and meaningful and fun way.
It's a fun way. So I always recommend that clinicians and family members have one of their own and model what they're doing with it, whether they're sometimes stirring a
Mm-hmm.
food or painting with the food
Yes, I love doing that.
or flinging it like this. And like you can do so
Yeah.
many things and before it goes in the mouth.
Right. As
So
we should, because if we're
yeah,
going to be desensitizing, getting used to foods, let's do a hierarchy as well of incorporating the side biter. So what can you lead us through that? What does that look like? Let's say someone comes in, they're NPO, and you decide on what age you want to talk about, but they come in, and where do you start? What does it look like? What is kind of that session progression? And what type of changes you expect to see? Let's say with someone that's developmentally delayed, not a TBI or something.
right. So say they were born early, they are 3.5, they haven't experienced a lot of food in their mouths, they've had respiratory problems, they were aspirating early in their lives, they now pulmonary wise, they're healthy enough to experience some flavors. What I typically do in a session in general is I use a mirror, I use massage, I see what they can tolerate with their own fingers, if they're able to allow me to bring their own hand to their mouth, to their face, to their lips, to see what kind of exploration we can do, even if they're a quadriplegic. I try to utilize whatever they have attached to them,
Yes.
and give them some early developmental experiences that they missed out on being
Mm,
sick in the hospital.
right.
So I look back on like what would have looked like for this child if they could have really used their hands to dip it in warm milk,
Mm.
or milk with maple syrup in it or something like that. I use smells. I talk about, oh, that smells like chocolate, that smells like gravy, whatever. And I make sure that they're swallowing, that they maybe can, what they're doing with their secretions. I don't go right to a tool. I try to see what it is that they can actually do.
Can I
And
just take a
then,
moment there?
yeah,
So good. You don't go right to a tool.
no, the tool is just something that is handy in your toolbox, that is there if you need it. It could be something that that can replace your finger. Again, I've had my finger bitten many, many times.
Mhm.
It's something that maybe could even be used for bringing smells closer to the nose and the upper lip. It could be something that families could feel comfortable, that they could bring it home and use it without food, use it with just scant flavors, scant smells, a little at a time, to incorporate. If the child is near the table and they're having barbecue ribs and they want to put a tiny bit of non-spicy au jus or whatever, and explain, this is what daddy's eating. This is butter. I love working with butter, as long as there's no
Me
food
too.
allergies.
Kerrygold. It's so good.
Yes. So food allergies, of course, you'd be watching for, but I would do things that are naturally occurring, easy to present, like butter, cream cheese, cookie butter, gravy, hummus, and I would start to bring that closer to the lips and the mouth. And when you feel that they would be, and I would use some temperatures. I like to have warm things in the mini, like warmed up, not hot, but like warm stuffing in there. And then versus frozen peaches, which would be frozen, to try to be like, oh, that's so cold. And maybe even refreezing some ice cream or my favorite is frozen pudding, because when it melts, it's still thick. It's not as watery as ice cream. So frozen yogurt, frozen pudding would work if you need to keep the fluid thick. And then I would just go from there. It's built on their reactions.
Yeah.
And if they can see you, hopefully the visual impairments are out there for sure. But I would have mom, brother, sister, dad, everybody be like, whoa, licking, moving, because it's different than a big chunk of food. Because if we're modeling this big chunk of food and this child is not ready for a big chunk of food or even a spoon, I would start with utensils that maybe the back of a spoon or the side of the spoon or an edge of a cup or a little bit of the straw, something. Those are all tools that we use. But then when it comes to actually utilizing side biting and maneuvering your tongue to the side, creating a rotation, creating a suction, propelling, that's when I really needed these tools, because it was too big of a jump for some of our kiddos with dysphagia. Since then, I've used it with selective feeders, and that's a different discussion.
Let's take a moment to talk about one of my absolute favorite tools for supporting health and wellness at home: ozone therapy. You know I'm a huge fan of finding effective, science-backed ways to support our body's natural immune defense system. That's why I've been using the Stratus 3.0 ozone generator from Simply O3 for years. Whether it's tackling ear and sinus issues or boosting overall health, incorporating ozone therapy at home has made it so much easier for my family to overcome illnesses and proactively defend against sickness at school. As a busy mom and business owner, I love that I can support my immune health without needing to run to a clinic. And let's be honest, most of the time, when my kids get sick, it tends to be at night when clinics are closed anyways. Simply O3 makes it incredibly accessible to bring the power of ozone therapy into your home. Their equipment is easy to use and designed with safety in mind. And because you're part of the Myohacker community, Simply O3 is offering 10% off your purchase when you use the code MyoHacker. Just head on over to simplyO3.com to check out their ozone generators and supplies and use the code MyoHacker at checkout.
I was just going to show you, this is the kit that has 3. They all come separately. The differences between them is the flow of the food. So a lot of people will say to me when they meet me, oh, you put purees in it. And I say, well, you can, except we don't chew purees. So my concept is to put strips of food or diced table food or even ground or grated food in it, so that when the patient learns to really chew and occlude the jaw, it comes out of the holes that are available on the SideBiter. The level 1 has 0 holes that we talked about. Level 2 has 5. The 5 go along the side, and the therapist can tip it according to where you want the food to flow. I usually get it flowing first. I'm squeezing the SideBiter level 2 because say I put stuffing in there or pumpkin pie. I know that this person doesn't have chewing yet. That's why we're developing it.
Right.
So I push it so that I have flavor on the outside, or in the case of the pizza, I'm rubbing the whole pepperoni and kind of the oil, that yumminess that we get. And of course, these clients have never had pizza before, so it's a shocker.
Yes.
This flavor is a shocker. So gradual exposures to flavors that they've never had before. Maybe they've only had Pediasure for 7 years.
Yeah.
Like, this is a huge shocker. And
Yes.
maybe they've never had somebody say, this is pizza. It has a crust, it has a top, it has cheese. Like, what is cheese? So I do a lot of education about, what that food is. Level 3 has 10 holes, 5 on one side, 5 on the other, and the flow is faster.
Yes.
In front of me, I have some olive oil. And the reason I have olive oil is because when I mentioned about engineering, when the engineer sent me the prototype, the original plunger went right in and locked, and I was like, that's great.
And
I
then
put, I think, a strawberry in it, and it all squirted out the end because it needed to be tight. So the reason I'm demoing this on here, I'm putting the plunger in, and you see how it doesn't go in all the way? It's on purpose because there's a drag on this. Me and the engineer put our heads together, and we learned that when the plunger part is wet, preferably with food juices like yogurt or whatever, or olive oil, this is why I bring it up. I'm putting a scant amount of olive oil on here because I want it to slide in really well. I'm sliding it in, and I am locking the bottom. The reason I like to lock the bottom, and I know certain people use this in different ways, they might want to load more food in it, and that's fine if that's working for you, but it was designed so that the pressure of the plunger, the green or the yellow in the case of the mini, keeps the food in the biting tip. Because if you don't, and somebody bites on it, you can make the plunger come out and no food is going in the mouth because all the food is going in the handle. So you might be seeing your client chew away, but there's not enough food in the mouth to cue transport and activate a swallow. So they could be chewing for 10 minutes and no swallow activation because if they're drooling out the saliva or whatever, you might notice, hey, there's no food.
We're not triggering it. Yeah.
Yeah. So I did cut some pizza just to share. It's in a strip. And so it goes in the handle like this. And I often have kiddos help me if they can motorically do this. So then it goes into the tip. I usually will kind of funnel it. And if I need more, I can put more in. And I often will use my little scrubby brush. So if it's something like I've used peanut butter and jelly and things like that, let me get my scrubby brush. The reason that I like the scrubby brush is if it's something sticky like a donut, which I've used before too,
Love
Um,
that.
like, how do you puree a donut? You really can't, right?
Right,
So
right.
why not put it in here? So this is somewhat sticky. So I'm just going to put some more cheese in there. Put a little more cheese. I
Can't
will
ever have too
use
much cheese, you know.
I will use my scrubby brush as kind of a tamper downer thing. That's a really that's a medical term, tamper downer thing. So I'm putting this, trying to get all the pizza to the tip.
So clever. I've never used the scrubby brush to do this. I end up
Yes,
just shoving more food in there to get it down.
you can, but if you're, you know, you can, and that's fine, because but you definitely want to make sure that it will lock, because
Mm-hmm.
then, so see how it's full to the top and you have the holes right there.
Mm-hmm.
So then when I'm chewing on it and it comes out of the holes, I'm going to try to see if I can get a piece that could show you that it's coming out of,
Yeah.
see, it's coming out of the
Yeah.
holes. But if this is not locked, some of it just goes in the handle, as I said, and it
Yeah.
won't go in the mouth. So sometimes on Instagram, I'll say, thank you for using that tool, but can you lock it? Because that's, believe me, I've chewed on this so many times. I'm like, I wonder what a shrimp would be like. I wonder what this ravioli. So I have my own right in my kitchen, and I
Yes.
always put things in it. And I think, okay, so this steak might be too tough for somebody with weak chewing. How about I grate it first? How about I take the meatball and grate it and then put it in
Mm.
and squeeze it a little and maybe put some broth with it.
So you
But
have
anyway,
not stopped inventing. You just haven't. Like it's clear. You're like as you're tweaking. You've got your like Tesla Einstein brain kind of on.
no,
And you're like, let's try this. Let's do this. And that's beautiful. That's so amazing because you're figuring out like, is this going to work in this situation or not? Keep
yeah,
going.
so
Keep
what I
going. I
like
just love
about
it.
angling this, so see the pizza sticking out of the holes? If I angle it toward my inner cheek
Mm-hmm.
and then I help the patient take it out, by the
Mm-hmm.
way, be careful about leaving it in so long that somebody can't activate a swallow.
Yep. Yep.
Be aware of, that's why I like to use it, because I'm like, okay, how many chews do I need before I need to activate a swallow and this comes out?
Mm-hmm.
So you can't leave it in there for 15 minutes because you need the person to close their mouth and activate a swallow. And you're trying to facilitate a swallow. If you're using Vital Sim or using whatever, massage, or you're feeling, making sure that there's some laryngeal elevation going on. And that's what I train my families to do, which, by the way, during COVID, when we went on virtual and I couldn't be in the room with these clients, I would send these in the mail and say, okay, we're going to use scrambled eggs or we're going to use whatever. And I had mine and I was chewing and I was doing my, my lingual excursion, and I was doing like lots of things, not just for chewing. There's so many tongue lateralization things and tongue elevation and things, target practice. So especially the kids that are really at risk for aspiration,
Mm-hmm.
moms and dads felt very safe
Mm-hmm.
using food from their family table, like a French fry, even out and about, and that little one or big one could experience it at the same time.
That's
And they didn't
so
have to,
incredible.
they wouldn't be just sitting there in the wheelchair doing
Yeah.
nothing. So
Yeah.
what I found was there was so much improvement in food knowledge, in
Mm,
confidence in the family, in
mm,
hope that this child could, experience food even if they couldn't ever wean from the G tube.
right.
Mothers would be like, I just made banana bread and it's in the level 2 and it's
Yay.
so great.
Oh.
So
And
anyway,
and just like you said, even the linguistic aspect of it. If you have never experienced food, just these concepts of cheese, of sauce, of crust, like that has nowhere really to land. It's just there's why learn that? And so all of a sudden this is changing that communication connection pathway for them, and just now they do want to know what it is. If for no other reason than that they don't like it. That's fair. They can do that too.
Well, when families started bringing in to me in the clinic setting, like homemade soup, and the mom was like, my child's 7 and never had my homemade soup. And I would pick out the pieces that would like fit in the mini, like maybe the soft noodle, and it had broth with it. And it was, and when we activated the swallow and maneuvered and did some sucking and propulsion, and then I might have done some grinding on the side of the noodle so that we could go to the next step in the same session. I'm not saying stay with this tool the whole session. I'm saying use the food in various ways outside of the bridge tool, because you're assessing the whole time what's going to happen. And so when that mom was like, oh my God, we went from soup, my noodle soup or my matzo balls are now in this. She was so excited. And then that was a hopeful thing. And the child feels that. They're like, I'm actually doing something good. I don't know what it is.
Right.
Yet.
But I can see mom is like radiating enthusiasm and joy right now. So I'm going to keep doing this. And
here's a flavor I've never had before. And my taste buds have never worked before because I only have, what I have, formula or whatever it is.
And for so many kids, I will often talk to kids about like, you don't even try to decide if you like a food or not until you've had it 13 to 15 times. Okay. I want you, because our bodies need to have time to generate those enzymes to even manage whatever that food is. And our brain needs to be able to sort it and put it somewhere. So if it's brand new and we have nothing like it ever in our experience, we won't like it. Because there's no way to organize that information. There's no way to even just meaningfully digest it. So give the body a time to warm up to it. And then we create that opportunity to actually enjoy it. I mean, I love that freedom that it's creating in that space that just didn't have any alternative before you created this.
Right. So one last story about level 1. There was a case of a quadriplegic 3-year-old who had a disease, and he saw me for a while, and I had to make the decision that he wasn't really safe for food, which was really hard. But I, wanted, and he really wasn't safe to have scant flavors.
Right.
Mom came to me and said, my boy is developing molars. So if you don't use your gums to chomp on anything, your teeth don't erupt on time.
Right.
So he was crying and crying and crying and crying because all his teeth, he was 3 and all his teeth were like coming in all together. So she said, and he couldn't hold anything. She said, do you have any suggestions? And I thought of filling level 1, 0 holes, right? With water, freezing it, and offering it on the inflamed gums. And how I taught her to do it is just count, put it on, so it'd be like here, and go 1, 2, 3, and take it off. I didn't want her to give his gums frostbite.
Yeah.
People have reached out to me and said, you're going to frostbite these people using frozen SideBiters. I'm like, no, because clinicians have common sense, and it's just a tool to give some thermal stim. But in his case, his little gums were literally bleeding. And so I just didn't want her to just leave it on there indefinitely. Anyway, so she did it, and I had her sing to him and upper and lower and upper and lower and upper and lower. And he was a big drooler because it was hard for him to swallow his saliva. So I had have him in a good position, not laying down or anything. Anyway, she came back to me and said it was completely a success. So it was a way to utilize it, not with food, with comfort and with quality of life. So that's what it is. I find different things to use it for all the time.
Yes, as you're in your kitchen. I love it. I can just picture you like, let's try this. Let's do this thing. So One question, because I will recommend this and talk about it, is people will say, well, I just use milkshake straws. I don't need the SideBiter. What do you say to that
So I
rebuttal?
say that milkshake straws are great and I should own stock in those.
Right.
And I still use them today.
Yeah.
But if you're going to fill that, first of all, if you're going to use any tool that has nothing to do with food flavor or food aspects, it normally doesn't translate to food. Those are the kids that could chew on their clothes or on a chewy tube for 20 years, but they won't chew on a piece of pizza. I fully believe that it has to be paired together with the smell and the taste and the particles that occur when you are chewing your food, because we make particles in our mouths and the mouth has to get used to those particles and where they go and how to sweep those particles, gather them up into a bolus and activate a swallow on time. We don't chew purees. So dipping something in purees is not going to translate to a dissolvable solid. Also, if you're going to load a chewy tube or a silicone straw with a strip of pizza, just know that it ejects in the back of the mouth. And I would wholeheartedly suggest that clinicians practice that before you practice it on someone else. So if you're using something with ham and you're putting it in the hollow end, do it on yourself at home first or in your clinic room and see how the food actually acts. I mentioned earlier that I would I would put food in it, in the silicone straws, fold them in half, and then use like a safety pin and put tons of holes in there. The thing with that is it weakens it. It's not, the flow is not consistent. That's why in the SideBiter, there's holes that are all the same size. The bounciness, which I really want, the proprioception of, okay, my jaw is depressing and it's opening and it's depressing and opening again, to try to get the, not just 2 chews, but I want 15 chews. I want some reciprocity. I want it to keep going for strength and stamina. So that is one reason. Also, you can't really send home a silicone straw with a family and say, put scrambled eggs in this 3 times a week and I'll see you next week, because it's hard to control. So that's why I needed the mini and the SideBiter tools, because I felt like for a short duration of time in therapy, I could control the food in a safe, hierarchical manner that could get this client to the next level or not. The other thing is, if you're just using it for flavor and quality of life, I have kids and adults that use it for their birthday cake, or they use it for special holiday meals, and that's okay.
Yeah.
That's
They
okay.
still are involved and still are a
still
part of the
involved.
experience. Yeah.
Yep.
I mean,
and I don't put sharp foods in it like nuts or seeds, but I have crushed dissolvable solids in there and graham crackers, and it makes a lovely noise.
yes, they love that.
They love the crunch, 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 because if you think about it, if you've never had a crunchy thing in your mouth, it's a sound that's quite scary. I'll even crunch it near their ear or crunch it in my mouth and be like, this one sounds big. Like scrambled eggs has no sound, but crushed Cheerios has a sound. I mean, they're actually startled, like, what is happening right now? Sounds like your teeth are crumbling in your mouth. So,
and to show them
kids,
they're not, they're there.
no, but some kids really think that that's hilarious. And they'll say, I'm not going to eat it. I'm like, no, we're just going to crunch. And they're like, okay. So they're crunching away. And before you know it, they're actually are eating.
Yes. So I know people are listening and they're like, well, I want to buy it. Where do I get it? How do they follow you? Tell them all the ways to be connected to you and how they can get one.
Okay. So the hardest part of this whole project is trying to get the word out, because I am not a marketer. I'm not a business.
I think you are. You're a born, because you're so vibrant. If anyone just lays eyes on you and hears you talk about this, boom, marketing done.
You
So
should see me with
everyone,
my hair. So if you want to follow me on Instagram, which I just learned how to do Instagram the last year. A year ago, I had 20 followers, and I think they were my friends. And now I have almost 3,000. And it's
woohoo,
side_biter on Instagram. I learned how to do it. And you can see back in May when I had hair to my waist, I right now am in chemotherapy, so I am bald, but that's okay. I don't need hair to be a clinician and a human.
and
So
to shine brightly, because anyone who's watching this sees you're just a spark. So
so you can follow me that way. You can find it's online. My online store is SideBiter.com. And you can see demos on there of how to use it. And there's different ways to purchase them, different collections. Like you can buy 3 for a certain amount, 2 for a certain amount. And today, with permission from Biohacker, I have a special discount professional code that you would put in on checkout. And it's Biohacker, all caps, 10. And you'll get 10% off and free shipping. Just so you know, that's the other thing I struggle with, because I want it to be affordable, especially for families. And during COVID, because it's medical grade silicone, all the silicone went crazy with prices, and the scrub brushes, they're 5 times more than they were 5 years ago.
my
So
gosh.
I really try to keep my price as low as I possibly can and stay in business. So many people have reached out to me that are actually like lawyers or real business people. And they're like, you need to increase your prices. I really don't want to. So right now they're there, and I'm planning on keeping it like that at least through ASHA in next fall. I'm going to go to ASHA and have a booth. I was there when it was in Boston, because I'm from Boston. I met a lot of people, and it really launched then. I wasn't able to go anywhere this year because of my cancer treatment. But anyway, that has been hard because I want to cover the cost. And that's why, I'm giving you the Biohacker 10, because I really feel like I made it as something that we needed in our field. I didn't make it to make money. I really didn't.
Well, you should make money, because we want you to be able to live your life and
Just
give as
saying.
you're doing. So
It's a-
what we need to do, guys, is spread the word, because that way you can buy it more in bulk, the supplies, because I know that is a way that you can bring
Yeah.
down your costs as a
So I do
manufacturer.
have bulk pricing. I
Mhm.
do have bulk pricing. I'm lucky when hospitals and clinics, when they order in bulk, meaning over 10 items, they get a discount. Over 20 items, they get a discount. And right now in the US, it's free shipping. So I'm lucky through
That's amazing.
Instagram. I have a collaborator in Athens, Greece. And I was lucky enough to get invited through Instagram to Athens this past May, before I got my diagnosis of breast cancer, and presented with her. And it was so amazing. Never been anywhere. And it was we had a talk about, in general, feeding therapy, and then when to use bridge tools. And it wasn't about selling the biters. But anyway, and I also have a collaborator in Australia through Grow Pediatrics. So that's been really cool to reach that far out, and just from Instagram, folks. It's so cool.
So I know I have listeners all around the world. Like, I'll see a little map. So guys, I know there are listeners in Germany, in Sweden, in Norway. Like, reach out to Cheryl. We want to spread this. If you have a podcast and you're listening to this, please invite Cheryl on. Okay. I really want to spread the word about this, because I have seen it change so many lives. And as you could hear from Cheryl's description, it's a tool that is made to increase independence and quality of life more than anything else. That is the heart of it. And so we really want that for families and individuals. So I will have all of this in the show notes. If you're listening on your phone or you're listening, you can scroll down and you will see the links to Cheryl, her Instagram. You're going to see the links for SideBiter.com. All of that will be there. I just want you all to know it's an incredible resource. I use it and I continue to use it. And I am so grateful for Cheryl and her time here today. I just continue to be the bright light that you are and share and change lives.
Thank you for having me. I'm just so grateful to be on with you.
I hope you have enjoyed this episode of the Biohacker Podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to biohackerslp.com for in-depth resources and guides. You can also join me on Instagram at biohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers. We change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.